The male body is a complex and fascinating system, with countless processes working together to maintain health and vitality. Among these, one phenomenon that often piques curiosity, sometimes causing concern or confusion, is the occurrence of erections, especially those that happen during sleep or upon waking, commonly referred to as morning wood. To understand the normal physiology behind erections and morning wood, it's important to explore the intricate coordination between hormones, nerves, blood vessels, and psychological factors that make these events possible. An erection begins as a response to a combination of signals from the brain, nerves, and blood vessels. In a state of relaxation or sexual arousal, the brain sends signals down the spinal cord and into the nerves of the penis. These nerves release chemicals that cause the smooth muscles in the arteries supplying blood to the penis to relax and open wider. As a result, blood flows into two chambers inside the penis, known as the corpora cavernosa. The increased blood flow fills these chambers, making the penis expand and become firm. At the same time, the veins that drain blood from the penis constrict, trapping the blood within and sustaining the erection. For most men, erections are a regular part of life, beginning in infancy and continuing throughout adulthood. They can occur in response to sexual thoughts, physical stimulation, or even seemingly without any conscious trigger. What many may not realize is that erections are not solely linked to sexual arousal. In fact, men experience spontaneous erections at various times, often during sleep or upon waking in the morning. This brings us to the phenomenon known as morning wood, or more formally, nocturnal penile tumescence, NPT. NPT is a normal and healthy process that occurs in most males, from adolescence through adulthood. Throughout the night, during certain phases of sleep, the body undergoes a series of physiological changes, including the occurrence of several spontaneous erections. Sleep is divided into several cycles, each including light sleep, deep sleep, and rapid eye movement, REM sleep. REM sleep is the stage most closely associated with vivid dreams and increased brain activity. During REM sleep, the body experiences a temporary drop in the neurotransmitter noradrenaline, which typically helps maintain muscle tone and inhibit erections while awake. With this inhibition reduced, the parasympathetic nervous system becomes more active and spontaneous erections occur. These erections are not necessarily related to sexual dreams or arousal. Rather, they are a natural, reflexive process. Most healthy men will experience 3 to 5 erections during a full night's sleep, each lasting anywhere from a few minutes to as long as half an hour. The final erection of the night often coincides with waking up, leading to the phenomenon of morning wood. This regular occurrence is actually an important indicator of good vascular and nerve health in the male reproductive system. But why does the body do this? What purpose do nocturnal erections serve? While the full answer is still not entirely understood, several theories have been proposed. One leading idea is that nocturnal erections help maintain the health of penile tissue. By regularly filling the penis with oxygen-rich blood, the body keeps the tissue flexible and well-nourished. This may prevent scarring or tissue damage that could interfere with erectile function in the future. In this sense, morning wood is not just a curiosity, it's a sign that the body's systems are working as they should. Additionally, nocturnal erections can serve as a diagnostic tool for doctors. If a man is experiencing difficulty achieving or maintaining erections during waking hours, but continues to have nocturnal erections, it may suggest that the cause is psychological rather than physical. Conversely, a lack of nocturnal erections can indicate a problem with blood flow or nerve function, prompting further medical investigation. In this way, the presence or absence of morning wood can offer important clues about overall health. It's also worth noting that the frequency of morning wood can vary widely. Age, stress, sleep patterns, medications, and overall health all influence how often nocturnal erections occur. Younger men may notice morning wood nearly every day, while older men may experience it less frequently. Occasional absence of morning wood is not usually a cause for concern. Many factors, such as poor sleep, alcohol consumption, or a heavy meal the night before can suppress REM sleep and, by extension, nocturnal erections. However, a persistent and unexplained change in this pattern may warrant a conversation with a healthcare provider. Understanding erections and morning wood as normal, healthy processes is important for both physical and psychological well-being. Too often, misinformation or embarrassment can lead to unnecessary anxiety. In reality, these phenomena are signs of a functioning nervous and vascular system, and their presence is a positive indicator of sexual and general health. Beyond their physiological significance, erections and morning wood also play a role in sexual health and relationships. Open communication about these normal bodily processes can help dispel myths and foster better understanding between partners. Recognizing the wide range of what is normal can also help men feel more comfortable and less self-conscious about their bodies. In summary, erections and morning wood are the result of a finely tuned interplay between hormones, nerves, and blood vessels. They are not just responses to sexual arousal, but serve important roles in maintaining tissue health and providing insight into the body's condition. For most men, experiencing morning wood is simply part of the body's natural rhythm, a silent affirmation of health occurring each night as the body rests and repairs itself. Far from being a source of embarrassment or confusion, these events are a testament to the remarkable coordination and resilience of the male body. Understanding and accepting them as normal can help promote a positive attitude toward one's health and well-being.